Good evening from Wolfville and Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. We take a moment at the beginning of our virtual events and our events in person, regardless of where we are, to acknowledge the Indigenous ground on which we are meeting. We do it more than just to do so and to say we did so. Certainly from a personal perspective, it is one, for me and for most, it is one very, very small step in truth and reconciliation. First, in accepting and verbalizing and understanding the truth, and then understanding what role we play in reconciliation. We ask everyone this evening who's with us to please take some time to think about what that looks like for you and in your world. My name is Oonagh Proudfoot. My pronouns are she, her. And I take a moment to share my pronouns with you as a step, also one small step, in attempting to increase and improve diversity and inclusivity in our school, our university, our society, our lives. So by sharing with you my pronouns, I am sharing with you that I am welcoming of all, however you identify, in this session and in all the work that we do in the Alumni Office. I'm the Executive Director of the Alumni Affairs in the Office of Advancement at Acadia, and it's an absolute pleasure to be here with you this evening. We have been doing virtual events since the beginning of the pandemic, and we continue to do them for folks around the world. So we have alumni literally around the world, and we found that by providing these virtual event opportunities, and it enables people who aren't normally able to join us in in-person events, because we're not in their geographical area. Sometimes we have alumni who are of an age and stage in their life that they're not able to physically get to our in-person events, so they certainly enjoy our virtual presentations. And it's also an opportunity, as I said to our presenters earlier this evening, that it helps us add to our virtual event library, which continue to be viewed long after the real-time event. I'm joined here by 4 alum of Acadia, who will be sharing their individual experiences with us in their career so far, wherever they are in their careers, age and stage. And we've chosen the 4 panelists this evening in an attempt to try to share with the audience various ages and stages in a career in care, whatever that looks like. So we certainly have a brief bio to share with you on each of these panelists. They have joined us and shared their time with us because they're keen to share with you and to talk to you and to hear your questions. We understand that we have a lot of students with us this evening, which is fantastic. So please, if you're considering a career in medicine or a career in care, whatever that looks like, this is your opportunity to ask these 4 alum anything that you'd like in terms of how they got to where they are. So joining us this evening, we have Eric Balser, class of 1992. Eric grew up in Digby, Nova Scotia, and graduated from Digby Regional High School in 1982. Following this, Eric studied medical laboratory technology at the Nova Scotia Institute of Technology in Halifax, graduating in 1985. In 1992, he graduated from Acadia University with a BSc in biology after a short career in medical laboratory medicine. He attended medical school at Dalhousie University and graduated in 1997. Eric completed family medicine residency in Newfoundland and Labrador in 1999 and special training in addictions medicine during his residency. He practiced in traditional primary care from 2000 to 2020. Eric gained experience and skills in obstetrics, emergency medicine, primary care medicine, geriatric medicine, and addictions. He held a medical director position of the Addiction Services Inpatient Facility in Middleton, Nova Scotia for approximately 10 years. Eric was a member of an opiate use disorder treatment team in Middleton for 10 years and is currently working in a collaborative primary care practice in Digby with a focus on optimizing collaborative and seniors care. Eric has a strong interest in advancing primary care to optimize efficient and accessible care for people who do not have access to their own assigned care provider. Other interests include biology, birds, bugs, forests, water, ecology, music, and spending time caring for his small piece of property, or perhaps maybe a small piece of heaven, on the Bay of Fundy. Next up, we have Chris Ogbuah, class of 2009. Christopher Ogbuah is a graduate of Acadia University with a BSc in biology while playing varsity basketball. Following his time at Acadia, he pursued and completed his medical degree from Saba University in 2016 and began an anesthesiology residency at the University of Buffalo, which he completed in 2021. After residency training, Chris matched into a fellowship at the University of Pittsburgh Multidisciplinary Adult Critical Care Medicine Program. He has since moved back to Nova Scotia, where he is a staff anesthesiast and critical care medicine physician in Cape Breton. And I think I met Chris in his first year of university, and we've been friends ever since. Next up, Natasha Harlow, class of 2013. Dr. Natasha Harlow is currently a staff emergency medicine physician at South Shore Regional Hospital in Bridgewater and Queen's General Hospital in Liverpool, Nova Scotia, where she resides. She completed an honors BSc psychology and biology degree in 2013 at Acadia. During her time at Acadia, she was involved in the SMILE program and was a student director for the program during her final year. She also worked as a residence assistant and senior resident assistant. After Acadia, she went on to complete her medical degree at Dalhousie University in 2017 and matched to the Dalhousie Family Medicine Program of Halifax in 2019. Natasha began a full-scope family practice at Twin Oaks Hospital in Muscatawbet Harbour, where she worked in office practice, long-term care, inpatient medicine, as well as rural emergency medicine. Discovering emergency medicine was her passion. She applied to the Dalhousie University Enhanced Skills in Emergency Medicine program as an in-practice applicant and completed that program in 2023. Upon completion, she and her family relocated to the South Shore of Nova Scotia, where she now works as an emergency medicine physician and holds a faculty appointment as assistant professor in family medicine and emergency medicine at Dal. In addition to being a physician, Natasha is a mother of 2 children, 2.5 years and 3 months old, and a husky named Luna. She loves to do yoga, hike, and spend time at the beautiful beaches on the South Shore. And last but certainly not least, our most recent alum, Sophia Blanchard. Sophia grew up in Dartmouth, Nova Scotia, and graduated in 2023 with a Bachelor of Science, majoring in biology and minoring in chemistry. She's interested in health sciences and plans to get her MD in the future after pursuing a master's degree. During her time at Acadia, Sophia was the VP of Communications for WISE Acadia and is very passionate about getting younger girls involved in STEAM pathways in university and high school. She also spent her time tutoring at the Biology Help Center at Acadia and speaking for Acadia's Pre-Health Society to help younger undergraduate students navigate the MCAT and other pre-medicine endeavors. Although she was actively involved across the Acadia community, Sophia takes great pride in her position as Life President of the class of 2023, a position which led her to the Acadia Alumni Association's Board of Directors. It is Sophia's second year serving on the Alumni Board as an ex officio member, a position which has allowed her to stay in touch with Acadia family as a young alum. After graduating in May 2023, she is working part-time while applying for medical schools and master's programs. And Sophia has been volunteering at the Wabanaki, probably did it wrong again, Labrador Research Network at Dalhousie on a project that she had worked on during her senior year at Acadia. So welcome to all 4 of you for being with us this evening. Thank you. The 4 of you combined, that is a lot of experience. It's a lot of knowledge. It's a lot of decisions, probably a lot of pathways chosen. And that's exactly why we're here this evening, is to chat with you a little bit about how you ended up where you are, regardless of where it is that you are in your age and stage. And I keep using that phrase. And to provide an opportunity, as I say, for the folks online to ask questions if they so desire. And again, just to reiterate, you can do that by raising your virtual hand, by writing in the chat function if you prefer. And you also are more than welcome to engage your video and engage your microphone and ask the question. So what I'm going to do first is ask each of you to share a little bit more about yourself. What I've just read is your formal bio, sort of checking off the education and the places where you've worked and where you work now. So I'm asking each of you to take a couple of minutes to share with us a little bit more about you, maybe a little bit about how you ended up where you are, something in the bio that you wanted to write but you weren't sure if you should include, or something that is particularly driving and passionate for you right now. So I'll kind of toss that out there, and maybe what I'll do is I'll ask Natasha to start. And I'm picking on you, Natasha, because you were the first panelist to sign on. So over to you.
All right. Hi, everyone. It's nice to be here. My name's Natasha. Struggling I didn't write anything formal to answer this question, Oonagh, so now on the spot going first, I'm trying to think of something. So I grew up in Porters Lake, Nova Scotia, so on the eastern shore of Nova Scotia. Interestingly, my grandmother was a nurse, and when I was about 3 years old, my grandmother actually gave me like a little toy Fisher Price doctor's kit. And my grandfather was sick at the time, so he was an inpatient. He was getting cancer treatments, and my grandmother would take me to the hospital, and I guess I would run around to all of the inpatients and like put my stethoscope on and like check their hearts and like whack their knees with my reflex hammer. And so anyways, I guess I knew I wanted to work in healthcare when I was 3, thanks to my nurse grandmother. Other interests, I actually wasn't sure what career in healthcare that I wanted to have for sure. I thought medicine, but I also really liked psychology. So I applied to PhD psychology programs, and I actually almost accepted a position at the University of Calgary upon graduation. But then I was fortunate enough to get into Dalhousie the same year after graduating Acadia. And as many of you know, it's a bit of a crapshoot to get into med school these days. Lots of qualified candidates don't get in, so I decided to, take that opportunity when it presented itself. So I went to Dal. In terms of other interests for me, when I was in family practice, I was really interested in women's healthcare. I did a bit of obstetrics as well. I work for the medical assistants in dying program as well, so I do consults for that program. And now I work primarily as an emerge physician. Was that enough?
That was fantastic, and absolutely appreciate you sharing your story about being a young budding healthcare professional, because we all know it starts somewhere. So knowing where it started for you is amazing. And I appreciate you speaking to the med school that you went to. And we actually have 3 different med schools represented here, so we may get into a little bit on sharing your sort of positives and maybe not so positives of each of the med schools that you went to, if we have time. So Chris, I'll go over to you next for a similar intro from you, please.
Sure. Hello, everyone. Great to be here. This is really exciting. This is something that we didn't necessarily have when I was at Acadia. So this is excellent for you guys to just have an opportunity to kind of ask your questions and speak freely to us. So kind of piggybacking on what Natasha said, I actually grew up in Newfoundland. I'm a first generation Canadian. Neither of my parents are from Canada. My dad was from Nigeria. My mom was from Ireland. My dad went to medical school in Ireland at the Royal College of Surgeons, and then moved to Canada for what was supposed to be a year, and then ended up staying. My brother and I were both born in Newfoundland. And then I moved to Nova Scotia and went to Acadia. Had a fantastic time at Acadia. Natasha mentioned the SMILE program in her bio. I worked in the SMILE program for a number of years. I was also a student director there on Tuesday, Thursdays, and enjoyed that immensely. Medical school, I took a bit of a convoluted route to medical school. As you heard, I went to Sophia University and spent a fair bit of my training in medical school and residency in the US, doing all of my residency and fellowship training there, which was an experience, and glad to now be back in Canada and working with a population that I can see myself being here for a while and enjoying all that Nova Scotia has to offer.
Super, thank you very much for that, Chris. And love, obviously, the fact that you were raised in Newfoundland, so we've got that commonality. And then we're gonna go to Eric next. We're gonna knit from one Newfoundland to the next Newfoundland, and hear from Eric a little bit about his education in Newfoundland. So over to you, Eric. You are muted. There you go.
I've been trying to think what I would say as you warned us about that question, and I guess I could go on. I thought my bio went on a lot more than it should have in the beginning. So I guess what I'd like to say is you work exceedingly hard to get into medical school, and then you work exceedingly hard to succeed or to have to graduate from medical school, and then the real work starts. And to summarize, I would say that the first part of my career was spent using this incredible education and skill set that I had to try and learn how to take care of rural Nova Scotians as I practiced in a small town upon graduation. And I was extremely well prepared for that with both with my education and residency training. I was keen and very interested in helping try and move the medical system and primary care, family medicine, if you will, along. My passion became collaborative practice. It's an interesting concept in primary care that we could go on a lot about right now, but I'll keep it at a comment about how being a solo practitioner is almost impossible these days. One needs people around them and great connections and great communication amongst all the other caregivers. So a collaborative practice is really what you need to focus on in order to keep focused on primary care. So I've switched towards perfecting collaborative care in my current career path, which is now part-time in primary care in my hometown of Digby, which I love and enjoy being here, taking care of people that if I don't know personally, know of them and their family personally. It makes a big difference to me, I'm happy to say. And I guess the main message or thought I have for you to leave with is it's a constant struggle in work-life balance. I smile at Natasha's family situation and realize how difficult it really is to have babies and be a general practitioner. But anyway, I find the ability to find work-life balance has been very elusive in my career. And I would warn and advise anyone to make sure they focus on work-life balance if and when they go forward in a career in medicine.
It's great advice right off the get-go, Eric. Thank you for that. And just a quick question before I go to you, Sophia. When you talk about collaborative practice, and then you reference being in a small town and knowing family of your patients, I would assume, and am I correct in assuming that is part of that collaborative care? So when you have that sort of network of community that you are able to tap into around care, is that a fair assumption?
I think it's perhaps such that people in rural areas are more aware of how they access specialist-based care or not just family physician-based care. And so, yeah, it makes a big difference to be able to plug into the community and the cultural and social context of each patient's experience, and help them go forward in their care if they need more than just primary care.
Right. And then the only other comment I was going to make is your bio's longer because you've been at it longer. Just for clarification, we're the same grad year, so it's just a little bit.
Okay.
Sophia, over to you. Tell us a little bit more about you and where you're at and where you're going.
Thanks, Oonagh. It's really nice. I see some familiar names in the participant list as well. So, hello. I sometimes wish I was still at Acadia, so it's making my heart warm. I guess I have a little bit of a more similar story to Natasha. My grandmother was a great seamstress, and my grandfather was an orthodontist, and so she would help me stitch up my teddy bears and things as a kid. And my grandfather, he bought me my first, I guess, a dictionary of anatomy when I was about 6 years old. It was way over my head, but I knew that it was something that I cared deeply about pretty much my whole life. Yeah, so I'm from Dartmouth. I went to Acadia and I just graduated in May. Yeah, so after that I was working at a physiotherapy clinic, And now in the new year, I've decided that I'm going to take the MCAT again to sort of, I figure I just have this time. I'm so young that I might as well do it again just to see if I can do better and kind of challenge myself in that way. You might think I'm crazy, but yeah, that's kind of where I'm at now. I'm traveling and yeah, studying.
Awesome. Well, there's going to be some MCAT questions, I'm guessing. So let's see where that comes from, or see if that comes out and where it comes from. And panelists, we have our first couple of questions in the chat function from Simon Roberts. Hello, Simon. Thank you for joining us from Washington, D.C. He says 2 questions, and I'm going to toss them both out there to all 4 panelists and see if anyone takes a sort of, I'll take a stab at that one. So the first one is, if the panelists could make one change to the Canadian healthcare system, what would it be? And number 2, what are they most excited about in the future for medicine? So I'll give you maybe 2 seconds to think about it, and then I'm going to pick on one of you. Go ahead, Sophia.
I can go. I had some pressing thoughts that came to my mind.
Sure.
I guess we could start with the bad, or my least favorite, I guess we could say. And I guess it's not really anyone's sort of fault, but being a woman, I think that myself and a lot of my friends have had struggles with just female health in general, and kind of having to be your own advocate when maybe you'd like your doctor or some other professional to be an advocate for you. I think that's something that could use a lot of growth. And the thing that I'm most excited for is, it's called Techigamik. It's an Indigenous-led, what do you call, like the NSHA, like a health authority led by and for Indigenous people. I think it's an amazing initiative, and it's only in early days, but I'm really excited to see where that goes. I think it's a great step in the right direction.
Fantastic. Thank you for that, Sophia. Chris, I think I saw you going for your microphone. You're up next.
So the first question, it's an interesting question, because you're asking it from, I think I heard Washington. Is that correct? Yeah. So I've had the experience of working in the U.S. system and the Canadian system. I think that there's a lot of positives and negatives to both systems. I think one of the biggest challenges in the Canadian system is efficiency, especially in Nova Scotia. It's efficiency, and then access to care, and access to timely care. Coming back and kind of seeing how difficult it can be. I'm in Cape Breton, Nova Scotia, and there's so many people that I see on a daily basis that are coming in for surgeries, and I'm asking them questions. I'm getting their history, and I see routinely the lack of patients with family doctors. And I think that that's one of the most difficult things to kind of navigate through. I see their frustration, and then I tend to get frustrated with their lack of access to care. But I do also see, you're asking for the positives too. So I do start to see the light at the end of the tunnel. I think that there are some movements in the right direction, and kind of a focus on primary care. Again, I am in Cape Breton, and there has been lots of news coming out in terms of having a new medical school here through the help of Dalhousie, and providing a family medicine first actionable plan to have people that are living here, coming out with a medical degree, training here and staying here. And that's the expectation. And I think we're moving in the right direction, knowing that that does take 6 to 7 years from the time the first students come into the program. But we're starting to see some change, and we're seeing people that are active and want to make these changes, which is exciting, and it's exciting to be in a place where people want that to happen.
Very much appreciate that, Chris. And as you pointed out, it's not an overnight thing. It's going to take a while, but certainly happy to hear that there's some optimism there, and a light at the end of the tunnel, as you say. Natasha and Eric, who'd like to get Natasha, go ahead.
Sure. So very similar to what Chris had said, is that I think the most difficult thing now all across healthcare in Nova Scotia is the lack of primary care access for patients. I say that as someone who actually left doing general primary care, because it was quite overwhelming trying to have a family and wear all of the hats, and wear all of the hats well. I was part of kind of a collaborative practice, but it didn't function very well. So as the physician, I wore a lot of hats even within my practice. A lot of time consuming things that could have been delegated to other personnel, but we just weren't set up in an efficient way to do that. So I think, what Eric is talking about, having well functioning collaborative care clinics will help that. It will help improve access to physicians, because the physician won't be doing jobs that aren't necessarily their job, if that makes sense. I held a lot of roles that could have been done by other healthcare professionals very well, probably better than how I was doing it. So I think, improving access to primary care is, improving collaborative care, making sure that everyone in their scope of practice is, functioning to the fullest of their scope of practice. And I think that will help things. I think another thing would be having a bit more of a mentorship program for new grads that are coming out, particularly in family medicine. It's such a broad field of medicine. You literally see babies that are 3 days old, just get discharged from the hospital, up to, I think my oldest patient in my practice was 103 years old, and I've seen somebody in the hospital that was 103 years old. So you see everyone. And you are expected to be able to, recognize, is the problem in front of you a very dangerous problem, or is it a benign problem, or something I have time to think about? And that's not a small task. So I think having a good mentorship program in place that allows newer physicians to feel less overwhelmed by how much is expected of you in general practice would be really helpful. In terms of what I'm most excited for, that's a good one. I think along the same vein, now that I do primarily emergency care, which I chose that just to have a bit more balance in my life. But I think the improvement of primary care and collaborative practices and access to primary care will help the Emerge be less of a dumping ground. Because the Emerge right now is a bit of a dumpster fire. So I kind of left one area of really difficult practice and dove headfirst into another area of very difficult practice. And we're all feeling the strain. All of the healthcare workers are feeling the strain. But what hurts me the most is the patients. There's patients waiting 24 hours sometimes in the emergency waiting room for care, and it's unacceptable, but everyone's working as hard as they can. So I think improving access to primary care, improving collaborative care so that the whole system can function better is what I'm looking forward to, but I don't know how long it's going to take to get there.
Absolutely. And you and I, all of us, and certainly most of the folks, if not all of the folks on the line, know that there are a lot more questions that we can ask in those regard, or in that regard, rather, in terms of the improvement and where it comes from and where it starts from and where it trickles down to and all that. So we won't dig too deep into that. I promised you it wouldn't be a political conversation, so I will do my best to keep to that promise. And we'll sort of ask some questions that will be helpful to the majority of our attendees. So over to you, Eric, for the question of one change and what are you most excited about?
Well, I'm glad I'm last because I had time to think about my answer. And I could go on and on. I'm sure we all could. I think the message that or the reality has been in my whole career basically that you cannot decide what to do about your health until a doctor tells you what you must do. Is an old model, an old way of determining the value and function of primary care. I think that one change to the system is not one, but a philosophy change, if you will, that there are many different primary care providers that you already know about and already see, but don't really think of them in that way, and in that they are working with or alongside physicians, but physicians are actually probably only one small part of what you need to be healthy and access or gain good care when you need it. So I cringe at the concept that we don't have enough family doctors, although that may be true. I think that we have to up the value and the accessibility and the professional abilities of all these other primary care providers, such as physiotherapists, pharmacists, social workers, psychologists, and I could go on. So one change that I'm advocating for, perhaps even experiencing, is that our people are realizing that the old school go to the doctor to learn what's wrong and what you have to do concept is behind us, and moving forward, one must understand their health and take care of themselves so that they don't get into trouble, and when they do, then the system is available to them. And so I guess it segues into the hope for the future, in that I see people, perhaps thanks to COVID, more equipped to pay attention to themselves and their own health, and become more engaged in what it is they need to be healthy. There's a generational influence where older patients, older people will perhaps not be able to grasp or adapt. Some do, but I think as we shift in as the system shifts, people will be much more equipped to take good care of themselves to begin with. I think that's very positive, and I consider myself more of a small cog in the wheel, if you will, as opposed to this illustrious person that you have to go to learn how your health is. It's simple to me.
Those are amazing words in a number of regards. So when I think about the folks who are on the line, and there's 60-ish of us, to hear those words and sort of take that to heart in the sense of knowing your body, knowing who you are, knowing what's right, what's wrong, what feels right, what feels wrong. But also the second part of that is, again, looking at the number of students whom we have on here this evening. I don't know what the exact number is, it's irrelevant. And in various degrees, and maybe all in the same degree, hearing that concept of it's a group, there are so many primary caregivers, there are so many people who can help when somebody's in a situation that they know themselves and know something's wrong. They advocate for themselves and they can access care and begin that healing process, whatever it looks like. And to your point, it's not just always showing up at a doctor's office and waiting to be seen by a doctor. So absolutely take that to heart as an individual, for sure. And then hope that folks on the line hear that and agree as well. So I'm going to segue into a couple of different questions. We've got another one in the chat function that I will get to in a moment. But two of you mentioned when you were students at Acadia that you were SMILE leaders. And I know for a fact that we have several SMILE leaders on the call. So I'm just wondering if you could speak to, if there is, an experience or a skill set that you developed as a SMILE leader that has become part and parcel of your current profession. So that's to you, Chris and Natasha, about your experience as a SMILE leader and how it helped you.
I don't know who wants to go first.
You are.
I can go.
Okay, go ahead, Chris.
I can go, Natasha. You've been taking the first a lot of times here. So I'm a huge advocate of the SMILE program at Acadia. There were a couple of questions that we kind of got sent to us just in terms of things that were asked prior to us coming on here, and one of them was kind of best advice for medical school in terms of work-life experiences, volunteer work, and I think so fondly about the SMILE program because I've been pretty fortunate through my training to kind of interview people for residencies, interview them for fellowship, now interview them for staff positions here. And what I find kind of tying all of that together is picking things and spending your time doing things that you enjoy. I think that Eric brought up a great point about work-life balance, and that starts when you're in university and when you're doing your undergraduate degree. All of these things, don't do volunteer work just to do volunteer work. Do things that you enjoy, and the SMILE program provides so many things that I carry with me every day. One of them, patience, understanding people, individuals. Everyone you see is going to be different. You have to be able to talk to anyone and everyone. Compassion, all of these things matter, and it provides such a foundation for you every single day that you're working with these children and young adults. And I talk about that. I've talked about the SMILE program, I think, in every single interview I've ever done since I left Acadia. It is one of the best programs I've ever been a part of. And I'll leave it at that.
Wow.
Thank you.
I would totally agree with Chris. So I started the SMILE program. I did the Friday night SMILE program the whole time I was at Acadia. So I started in my very first year. And you know, when you first start university, there's a lot of new experiences. People are doing fun things on Friday nights, and a lot of my friends would always be like, why are you doing that? Like, why did you choose to do a volunteer activity on Friday night when we're all, doing XYZ? And I persisted doing it because I genuinely loved doing it. I got so much enjoyment out of going to that program every Friday night. So I started as I don't remember what the names of the different roles are now, but I started working with some youth with various disabilities, and I did that for the first couple of years. And the things that I learned about people with various differences and navigating their emotions and how they're feeling and trying to interpret the world through their eyes has been life-changing for me. I then, for the second 2 years, was a student director my last year, I was a student director for the program. And taking on that role, I learned, different skills. So I wasn't necessarily working one-on-one with the youth in the program anymore, but I was helping other SMILE leaders, navigate the difficulties that, they might have been encountering. And I was responsible in a more leadership role. So scheduling and organizing and planning and, working with parents and trying to make sure that all of the participants were accommodated and that all of our activities were accessible. So it helped me develop a bit of a leadership skill set and a communication skill set as well. So I would say that program was invaluable to me. Certainly shaped my experience at Acadia, and definitely has shaped how I view the world, and understanding that, everyone is different, whether you have a disability or not. And you have to try and, see the world through everyone's lens, essentially.
Love it. Thank you for that, Natasha. Sophia, I'm going to come over to you next to chat a little bit about volunteer work and enjoying what you do and picking how you spend your time outside of classes. So outside of Smile, and I apologize, I don't know if you are or were a Smile leader, but I'm going to ask you to pick something other than Smile that you were involved with while at Acadia, and talk a little bit about, as Natasha and Chris just did, skill sets developed or something that you think will carry over in your pursuit of your career.
Can you hear me? Okay, perfect. So I was not a part of Smile, which I have a lot of regrets about. I have lots of friends who were involved in Smile, but it didn't match up with my schedule at the time. I would say that the most memorable at Acadia would be probably my time doing volunteer research with Dr. Jenny Rand. During my senior year, we did a project, and we were kind of focused on Acadia as an institution's. We used a community readiness model to assess Acadia as a community per se, their readiness to enact Indigenous research, ethics, policy, research principles. The time that I spent doing that as a white woman has given me so much knowledge and humbleness, I think, that will really affect me forever. And it's always in the back of my mind in everyday conversations regarding colonization and university, and I could go on and on about that. But I think that experience, if you can find someone at Acadia who has values that align with your own, or even values that you want to align with your own, is very powerful, and I think can create a lot of change for an undergraduate student, even if you don't want to go into medicine.
Great advice. So I'm hoping that some of the students on the line are not senior students, and that they have time to take that advice if they haven't already. So in speaking about volunteer experiences in your undergrad and how it segues into career paths, and your career path in particular, I'm going to take the next step and talk a little bit about choices of med school and or the med school that you attended. So we have Dalhousie, Memorial University of Newfoundland, and SABA represented here on the call. So I'm going to go to each of you and ask you about your choice. Did you choose it, or did it choose you? And a little bit about your positive experience. Tell me something good about those medical schools. I was going to go with what did you like and what didn't you like, but let's stay away from the didn't like, and let's talk a little bit about the pros of Dal, SABA, and MUN. Eric, over to you first.
My overwhelming recollection of medical school was that it was evil. It was very difficult. I learned not to give in to self-doubt and worry about my ability. Unfortunately, medical school tends to be somewhat based on aversion therapy teaching methods, which is tough because you're expected to work extremely hard, but also be able to answer any particular medical question that your teachers want to drag out of your brain, whether it's there or not. And sometimes it's an exercise in just showing that you can think on your feet, even if there's nothing in there coming out that they want to hear as an answer. I did not like that about medical school, so I found it hard to be myself and learn it in a way that I was most comfortable with. Perhaps as a mature student, it made it different. I don't know. But in the end, the classmates, the small groups within the class that you work with to measure yourself against and learn where you need to work on, what you need to work on, that was really easy to latch onto at Dalhousie. I'm not really sure why. I would imagine it would be the same in other somewhat smaller schools, but I really thought Dal was good at keeping the group of the class, the people in your class together, and at least in the first 2 years, where they made you learn who your friends were and who to get help from if you needed it within the class.
Thank you for that, and always appreciate the honesty and the candor. Chris, over to you next. I was going to go Natasha next, but she just finished, so over to you, Chris, and I'm going to do it quickly and mute because my dog is drinking very noisily right now.
Sure. So I went to Saba University. I had a bit of a convoluted route to medical school. I graduated from my undergrad in 2009 from Acadia, and I was actually in a master's program at Acadia when my father suddenly passed away, and he had a full family medicine practice in Newfoundland. So I was kind of at a crossroads in terms of how to navigate finishing my master's, deciding to go home and kind of help close my dad's practice. And I was left in kind of a position where I didn't know which way I was going to go. I had applied to medical school. After my undergrad, I got waitlisted, pursued my master's, and then I decided to step away from my master's to go home and kind of sort all of these things out at home. And then by the time all of this kind of came to completion, I was in the middle of a cycle where I wouldn't have been able to reapply to medical school until a year and a half later. And I was in a position where I had started a master's, stepped away from it. So my application was virtually the same as my undergrad, which I was waitlisted. So I made the decision that I still wanted to go to medical school. I was going to apply. I knew some people that had gone down to Saba. So I made the decision to kind of apply there, go down, and kind of forego the Canadian medical school route and work on coming back to Canada down the line. It was an experience. I will say that people will, if you go online, there's innumerable views in terms of what's right for every person. I felt like it was the right decision for me given the time in my life. What I will say is it's a very difficult road. Finishing medical school, I knew that I wanted to specialize, and I kind of chuckle when the family medicine docs are talking about their experiences. I feel like I took the easy way out by specializing because I think family medicine is the hardest specialty on earth, and I don't understand how people do it every day. The amount of knowledge that you have to have in order to care for your patients, I felt was insurmountable. So it's easy for me to do my job, and then I can say, oh, that's a problem that someone else can help. So I have very clear delineating lines in my work. So I knew that I wanted to specialize, and I feel pretty fortunate to be back in Canada now, practicing anesthesiology. I applied to the US. I was one of 12 Canadians to actually get a position to train in anesthesia in the US. And then my fellowship was at a phenomenal program as well. But it's a long road. There's a lot of hoops that I had to jump through in order to get back to Canada and to start practicing in Canada. But I wouldn't change my my road for anything. I learned a lot about myself. I learned a lot about the healthcare system in North America. Um, and I've got to see a lot of cool places along the way. So.
Well, Canada is very lucky to have you back. So thank you for coming back north.
Thanks.
And great insight, Chris. I certainly, I mentioned at the beginning that we met very early on in your career at Acadia, and we've remained friends. And certainly watching your career path along the way, it's always been. I've found myself fortunate to stay connected with you and hear about where you are and what you're doing, and landing back here in Cape Breton with Chelsea. So, Natasha, over to you. A little bit about your med school experience.
Sure. Firstly, I was trying to figure out, Chris, how we had crossed paths, because when I was looking at the years, I was like, that doesn't make sense. But you were doing your master's when I was there, so
my master's.
I'm so sorry about your dad, and that your route changed for you. But that's how we met, was Smile during your master's.
Yes.
So Dal definitely chose me. I applied very broadly. And I got interviews at a few places, didn't get waitlisted anywhere else, and then got accepted to Dal. I was not expecting to get in the first year that I applied, because I knew so many brilliant, qualified, experienced people that had applied and, in years before me and not gotten in. So I was like, well, this is my first stab at it. I can't get in if I don't apply. So I'm going to apply, and then I'll probably do, my master's or PhD, and I'll try again later. And then I got the letter, and I was absolutely shocked. And I got in. So Dal definitely chose me. I was very surprised. I really loved Dal. I had a wonderful experience at Dal. The classes were even though they're big, they felt very tight knit. I felt very supported by my peers. I got to know people really, really well. It was a lot of fun. I had a lot of fun. I will agree with Eric, though, that med school is one of the hardest things that I have ever done. Just the amount of knowledge that you have to learn and study for, and the exams and things. It was a lot, but it is doable. It's a doable thing. It's just a difficult thing. And looking back on it now, having done that as a young single person with no dependents, I'm like, wow, maybe it was maybe it wasn't as hard as I think it was, because my second round of starting staffhood and residency again with children felt much harder in hindsight. But I thought Dal was wonderful, and I'm really grateful that they took me, and that I got to do my training there. And then I continued and did my family medicine there as well.
And I appreciate you bringing up, we touched on it once or twice, but not in depth. And certainly I want to pick your brain a little bit if we have time. We're quickly running out of it. But I feel like I need a little shout out to anyone on the line who's thinking about a career and being a parent, and just knowing it is a career in medicine, a career as a doctor, and being a parent, and it is possible. So there's proof on the screen right here, folks, that it is possible to do both. So it's not a choice matter. It's tough, but it's not a choice matter. You don't have to choose between the two.
You can do
so
it.
You can do it. You can do it. So there's another question in the chat function that I want to get to, because I appreciate folks asking questions. Absolutely. And the question is the job of physician's assistant becoming more popular in Canada? And do you foresee this being an in-demand career within the near future? And I will be the first one to say, I don't know what a physician's assistant typically means. I don't know what sort of parameters that job is. So if there's anyone on the line who has experience or knowledge about the job, and the question of, do you foresee it being in demand in the future?
I can speak to that really briefly. So my understanding is that it's a university program. I'm not actually sure if it's an undergrad or if it's a program that you do as an add-on to an undergrad. But we had a brief stint in the emergency department that I'm working in right now that had a pilot program for having physician's assistants assist in the emergency department. I would say it's still very much a work in progress. We haven't really been able to figure out how to utilize those individuals and their scope of practice combined with our scope of practice. I think it's very possible. I think they'll add a lot of value and efficiency to the emergency department. I think we're just really struggling to integrate what that looks like and how we supervise those individuals, how we utilize their skill set while also still, essentially being responsible for the entire department. So I have a little bit of experience. We're still working on it. We're still trying to figure out how to make it efficient, but I do absolutely see value in it.
Absolutely fair. Thank you for that insight, Natasha. Anyone else? Go ahead, Chris, and then Eric. Yeah.
So they're quite well established in the U.S. It's a model that's used there quite a bit, a lot in the emergency department. The large benefit of them, I think, is within the triage system in the emergency department, identifying kind of and delineating streams, and that's how the U.S. uses it. The challenge, I think, again, as Natasha said, is kind of the crossover and meshing of the skill sets and how to effectively do that in an efficient manner. What I did find in the US was sometimes the physicians got overburdened with the oversight while maintaining the care of the patients that they're trying to care for. And to do it thoughtfully, I think is something that Canada has the opportunity to do. And these pilot programs certainly help. And I think there is a lot of utility in using them and finding kind of their niche and pursuing that. But I think it will take a little bit of time, but I think it does show some promise.
Thanks for that, Chris. Eric.
I just wanted to say I don't know very much about physician's assistants. I have worked with no physician's assistants in any of the various types of career paths I've followed. But in my career, we have gone from only physicians delivering primary care to having nurse practitioners. And I've worked with dozens of nurse practitioners, and if I can be so bold, I would say the ones I've worked with have all been able and experienced and capable individual practitioners, but also perhaps much better at collaborating because of the nature of their nursing training in the first place. And what I can say about physician's assistants is that if they integrate into the system like nurse practitioners are and should be in the future, it can only be an asset, especially if it means improving access to primary care, which I haven't seen a physician's assistant in yet. So. Right,
makes sense. And I think, it kind of circles back to one of the comments you made earlier in terms of, that frontline healthcare provider and who that is in what instance and when one can be used and when can a patient be redirected to a slightly different looking frontline healthcare provider. And I think that's probably all of those things will be part of the equation on how we improve the situation in general, but in this province specifically, referring to three of you who practice in the province. So we're going to wrap up, and the last question I'm going to ask is slightly different for three of you, and I'm going to start with Sophia though, and that is, so you're working on a master's, you're going to write the MCATs again. Do you foresee the possibility of you pivoting and choosing a different career? So that's your question. And for the other three, what would you be if you weren't a doctor? So Sophia, we'll start with you.
Yeah, absolutely. So right now, so I'm applying to medical schools, obviously, but I'm also applying to some master's programs. And I came across sort of the idea of doing an MBA before an MD, and I have no business experience at all. But I think that if I were to go into the direction of being a primary care physician, that could prove to be very valuable to me, and also learning something new, doing something completely new out of my comfort zone. I might just change my mind. I don't think that it is the dream or the goal, but I'm never closed off to trying new things, I suppose, or broadening my horizons.
Absolutely. And I asked you the question because I think it's interesting to hear the paths of the other three panelists and how it wasn't a straight line, and there were some changes and some differences along the way. So thank you for that. The other three, if you weren't a doctor, what would you want to be?
I'll take a stab. It's been about 3-4 years since I gave up on ever replacing Mick Jagger and the Rolling Stones. We're both getting too old in the end. Anyway, what I would like to be right now, if I wasn't a physician, is a biologist, of a wildlife biologist, and I really actually have to thank Acadia for my interest in biology. At the time, I didn't really recognize it, but I enjoy the forest. I enjoy small animals like bugs and bacteria and fungus. I know it sounds terribly weird, but I would love to be a biologist of some kind.
Doesn't sound weird at all. It sounds awesome. Chris or Natasha?
Yeah, so similarly to Eric, I gave up on my dream of being a professional basketball player a long time ago. But I would say if I was not a physician, I've always been interested in architecture. And I could see myself actually doing that. Yeah.
Okay, cool. Never give up on the basketball though, or the music, Eric. Go ahead, Natasha.
I think that if I wasn't a physician, the knowledge that I have now, I think I'd want to be a teacher. I think I'd want to be an elementary school teacher. At the time, I thought that I would want to pursue, psychology or a PhD and be a counselor. But I think in hindsight, if I didn't do a career in healthcare, I'd be a teacher.
Love it. All right, folks on the line. So you've heard different paths, you've heard challenges and obstacles and successes along the way, and you've heard what they would be if their path changed and if they were not currently a physician. So hopefully we've provided you with some content, some fodder, something to think about anyway in the next little while. For those of you from the alumni world who joined us, thank you very much for your time this evening as well. A big thank you to the four panelists. We're so fortunate when we reach out to our alumni to be a part of these conversations that we always get yeses. So I really, really appreciate it. And just a quick note that we do put everyone's name in for a draw, not the panelists. You're all going to get a little thank you from the alumni office anyway. All of the folks on the line, and the winner this evening is Colin Marshall. So Colin, we're going to track you down and send you out a little thank you for joining us and for being a fortunate winner this evening. Maybe you should go get yourself a lottery ticket as well. And to let folks know that our next virtual event session in February, we will be hearing from a recent addition to the Community Development Program faculty at Acadia, and she will be chatting with us about her research in remote communities, and very much presentation style, but always a great opportunity to hear some research from our faculty. Again, they never say no when we ask them. So Dr. Alicia Norega Monderoy will be with us, and she'll be chatting with us on forging school community partnerships, addressing inequities that hinder rural community development. So join us, please, in February. If you're interested, you can dial in from anywhere. So thank you, Sophia, Chris, Eric, and Natasha. Really appreciate it. Thank you, Victoria, for being our orchestrator back end. And thank you, everyone, for joining us this evening. Take good care.